So there have been two dramatic changes in my career in the past 5 years regarding how I do spine surgery. The first is the advent of virtual real-time intraoperative imaging. This allows me and my entire team, everyone in the OR, to see exactly what I'm doing virtually on a screen. Now, that has been married in the past few years with intraoperative robotic surgery. That allows me to potentially have more precision and accuracy with what I'm doing and to see what I'm doing at the same time. I'm able to, first of all, prior to the surgery, prepare the entire surgery beforehand on the patient's own anatomy. So we get a scan, then we reconstruct the patient's own anatomy, then I can plan every single screw and where I'm going and what I'm supposed to do. And the entire operative team can also know that as well. And then while I'm doing it, I can use that information to minimize the amount of incisions and the amount of soft tissue destruction that happened during the surgery. And then finally, I have the potential of increased accuracy of the screws that I'm putting in and can potentially do that more reproducibly over time. For instance, today the case that we're going to do involves a patient who was born with deformities in her spine, so none of the anatomy is usual or even recognizable in some cases. To add further complexity to that, the patient's had a prior surgery. That changed the anatomy as well. So I would have none of the normal landmarks to guide me through a surgery like this. If you told me even 5 years ago that I could use virtual imaging and robotics to decrease the stress on myself, my operative team, and my patient, I probably would have scoffed. But these are the tools that I have at Methodist Hospital Texan today, and ultimately they represent the potential for helping my patients with less trauma, decreased recovery time, and better outcomes. I'm lucky to have them.